And a hearty good morning and welcome to the webinar. So glad everybody could join us here on Tuesday, September 19th. Little touch of cold weather, a little touch of fall in the air. It's just beautiful here in Cincinnati today. And then we've got agents calling in from throughout Ohio, and we have Brad Petrella, my colleague in Northern Ohio, also here on the call, and Mitch Flowers from UHC. And just some little bit of housekeeping as everybody filters in. So I'll go ahead and let me put the other folks on mute real quick.
I got it. I took care of it, Jeff.
Okay. And Eric's on the call. Okay. Thanks, Eric. Thank you. So today is UnitedHealthcare's ACA update. Okay. So Mitch is going to go over all the new developments with UnitedHealthcare's ACA product in Ohio. You know the drill. If you got a question, put it in the question box. I'm going to monitor these throughout the presentation, so I'll jump in and be sure everybody's question is answered. So by all means, throw those questions in the question box. And here we have the three amigos of the individual market here. Brad, of course, in the Cleveland area. I'm based in Cincinnati, as well as Eric, and everything and anything you need in the realm of individual healthcare, anything doing with the under 65 products, let us know. And so much going on. Like I tell everybody, it's like 10 pounds of potatoes in a 5-pound bag right now. Everybody's kind of ramping up for OEP, which of course coincides with AEP on the Medicare side, but we like to think those are just two sides of the coin. And you know, we're going to help you navigate this busy season with all of our resources and all of our know-how and all of our marketing tips. So to that end, I want to talk a little bit about Health Sherpa. This is an innovative healthcare technology. It's the country's largest ACA enrollment platform, and with Health Sherpa's faster and easier alternative to healthcare.gov, you'll have the leading edge technology that you need to maximize your marketplace experience. And Health Sherpa is also the only agent platform approved by CMS to offer EDE, that's Enhanced Direct Enrollment. And on the call today is Eric Pouncey Jr. I just want to tee him up a little bit. Eric is professional in implementing these platforms with our agents. Eric, can you just say a few words about it, or your impressions? How do you think it works?
Yeah, it works pretty smoothly. If you definitely want to cut down on times of getting your clients enrolled, I think Health Sherpa is probably like the quickest way to get that done. But it's very user friendly, and if you need any help with it, just give me a buzz.
Fantastic. Yeah, quite often Eric, you know, will come in and remedy an issue or something like that you might have setting it up. So it's a great platform, and we've had nothing but great reviews and comments about it. Over half of what is sold by agents is through Health Sherpa. How about that? And I do want to talk about the webinars. If you didn't notice already, all of Cornerstone's recorded webinars are available in the Resource Center under the webinar series. And contact me or Jess Larkin at the marketing department to make sure you can log in to the Resource Center. So much is out there. It's a wealth of information. And I know, Brad, you and I talk about it all the time, and this is like a place you can see a lot of our old materials, right? Oh, he's muted. Okay, we can unmute you. Did the cat get your tongue? We're going to unmute you. Okay, let me unmute you. Brad, did the I guess I can't unmute you. Okay, you're muted, but we'll get you on here. Eric, can you get him unmuted?
I sent him a request to unmute himself.
Okay. There you are.
Sorry, I am unmuted. Now you guys are in big trouble.
Okay.
Yeah, the Resource Center, everyone, is really great. And currently we're just adding new content. So sometimes what you'll see out there, we're adding it every day after these recordings. So just be sure to check that out. Speaking of Health Sherpa, we had a great session about a week or two ago on Health Sherpa. So if you really wanted to see some of the inner workings of Health Sherpa, I would go there and review that training. It was supposed to be an hour, but so many great questions were being asked. It ran long, but nobody minded. Everybody stayed on. So really, really great training. I would highly suggest you going back to look at that if you're not expert in Health Sherpa. So that's it. That's all I wanted to say.
All right.
Don't ever unmute me.
Okay. Don't put baby in the corner. Yes. So with that, we'll toss things to Mitch Flowers. Mitch?
Can you guys hear me all right?
Yes, we can. And let's put myself and Brad on mute. Okay. I'm going to go on mute. All right. Okay, just waiting for you to open your screen. I can see your Outlook. Maybe you can go to your deck.
Trying to figure out which how I can change the screen.
We can see your Outlook. Eric can maybe jump in here real quick.
Let me try this. You guys see
okay,
that?
that's fantastic.
Welcome to Ohio.
Absolutely. That is great.
Yep,
you got it? Well, just welcome to Ohio full screen?
We got it. We got it. We're rocking and rolling. I'm going on mute again.
Awesome. All right. Well, thank you, Jeff. I appreciate you having me on this morning. And then I also just want to thank everybody else for taking the time out of their busy day to join us this morning for a quick webinar presentation. And I know this time of year is extremely busy for all of us. So once again, appreciate everybody taking the time out of their busy morning to join me today to talk about, well, we'll talk a little bit about 2023 as it stands right now, but I'm also going to get into 2024 and share with you some of the changes, some of the enhancements and expansions that we are going to be having for OEP 2024. So I'll start out with a little bit of introduction about me. I'm sure many of you already know who I am, but for those of you that don't, my name is Mitch Flowers. I am the agency manager for UnitedHealthcare for our ACA business here in Ohio. So, you know, like I tell all of our partners, I want you to think of me as just your local partner for all things UHC ACA. I'm here to help you be as successful as you want to be with all of your ACA endeavors as it pertains to UnitedHealthcare, as it pertains to UHC business here. A little bit about me. I was born and raised here in Columbus, attended college at Miami, so a little bit out your way, Jeff. I've been in insurance pretty much my entire professional career up to this point, in various facets, whether it was small group and ancillary and all kinds of different areas of the business. And I've been with UHC going on 3 years now. Have been with the ACA space since we re-entered a few years ago. So I've seen it grow. It's really been a tremendous ride this far. And as you guys will see here in a little bit, we've grown so much and we're continuing to grow and just having success all around. So with that, the agenda for today, just got the welcome out of the way. I'm going to start off by going into a little bit of market overview, kind of share that story about our growth and where we're going. We'll touch on the all-important network, any sort of updates we have in that realm, product offerings. We'll go into national marketing efforts, big changes there as well. Pharmacy and clinical. We'll end on operational enhancements and some Q&A as well. All right, so starting off with the market overview. Now, this first slide here, this is just going to kind of serve as a story for our growth since we re-entered the market back in 2021. And, you know, I just think it shows our tremendous growth just in this past 3 years. But it's also showing our commitment to the ACA space and and how we want to be here indefinitely, how we want to continue to grow. So as you can see, starting back in 2021, our first year back, we started out relatively small, just entering in 8 states, just around 28 markets. So kind of just getting our foot wet, getting back in the market. But as you can see here, the next year we essentially doubled our market footprint, 2022. And then for 2023, we added 4 more states, over 500 counties that we're in. And then you just look at for 2024, we're in almost half the states here in the union. But in terms of counties that we're in over 1,000 counties now. So just in that short span of 3 years, we've really grown from 8 to 23 states, just 160 counties back then to over 1,000 just in a couple of years. So, and like I said, I think what this means is that we are here to stay. This is our testament to our commitment to the ACA space, and just to show you that tremendous growth. The ACA is a huge deal to us, and we're here to stay. All right, so for our strategy, and this might seem like a little bit of corporate speech here, but I wanted to include this here just so you know some of the important points of the business that go into our strategy when we're determining our product portfolio for the next upcoming year. So the first one there, network strategy, of course, very important, age-old question. Network or premiums, which one's more important? I don't think there's an answer to that. I think both are equally as important, and they really are the basis behind what drives our strategy for the next year. So for network, of course, we want to make sure that we create a robust enough network that's going to be able to satisfy your clients, but we also want to do it in a way that's going to help us maintain our competitive premium. So our network continues to grow in both existing and new markets, and that's really just to give your clients the peace of mind they deserve when it comes to selecting a provider. So network, extremely important. Number 2, right there as well, pricing, network and pricing, of course. And with pricing, it's obviously no secret that this industry is extremely price sensitive, and having that competitively priced product is, of course, a top priority of ours. And we continue to make sure that is evident for 2024. Really making that balancing effort between network and strategy, or network and pricing, to make sure that we've got a solid product overall. Market expansion. So this is a major point of feedback that we get every year. Of course, our partners want to see us in more markets and more counties. So as it pertains specifically to Ohio, we're growing a lot in the state as well. So for 2024, we're adding 14 new counties to our footprint, including in the Columbus market. More on that in a little bit. And then retention. So retention is half the business, right? And we are really focusing a lot on retention this year, and you'll see that coming up later in the presentation. We want to make sure that you have all the tools and knowledge in order to create those long-lasting relationships with your clients. And we've got a lot of great resources and enhancements that we've made on the retention side as well. So a little bit more about our strategy, some other points that are important to us. Of course, we'll start at the top here at financial stability. Like I mentioned, we want to be here indefinitely. We want to be your partner in the long run. So maintaining that financial stability, being disciplined in our pricing, but yet providing those affordable options are extremely important to us. We want to make sure we're doing it right. We're doing it smart so that we're able to stay in this market indefinitely and continue to provide you guys with competitive products year over year. Consumer-centric offerings. We want to make sure, of course, that we're providing plans and benefits that consumers actually want. I mean, you can have a great price and a great network, but if you don't have plans that consumers want, then it really does no good. So we want to make sure that we're providing plans and benefits that your consumers are asking for to go along with that competitive network and premium as well. Operations are extremely important. I always say, like, you can have a big, beautiful car, but if it doesn't have that engine in there, it's pretty much worthless. So that's how it kind of relate operations as it pertains to ACA, right? We want operations to make that engine that drives that car to be smooth and as seamless as possible. So a lot of enhancements on our operations side. We really want operations to be a strong suit of ours and a differentiator. So more on that soon. And then last one, simple experiences. So we want to give our members a simple, seamless, smooth experience from whatever it is, whether it's selecting their provider or accessing their benefits or utilizing the incentives in their plans. We want to make sure that everything's as smooth and as seamless as possible and really give them that industry-leading experience so that they continue to stay a client of yours and ours as long as possible. All right, so network. So this first slide here, this is going to look familiar. This is for 2023. This was our network footprint last year, or this year. A couple more months left in the year. So I wanted to put this up here just to kind of show you where we started. And then, so for 2024, this map now is going to include all of our expansion counties. So you can see the growth that we've had here in just year 2 alone. A total of additional 14 counties will be in our footprint for 2024, bringing our total to 42 counties. And I think we're way ahead of schedule here. I didn't expect us to be growing this fast here in the state, but that's just a testament, to the success that we've had this far. And a lot of that success is due to you guys, our partners out there. So I appreciate that. But a little bit about our expansion here. Some additional markets will be in. The Akron market, of course, will be expanding there. As it pertains to hospitals and networks, we're working with some in there. It's still pending, but we're going to have a solid network in the Akron area as well. Batavia is going to be a new market for us, and including those 5 counties in the Batavia region down, actually where you guys are, somewhere close to you guys, Jeff, down there. So expansion of the Batavia County or Batavia market, Dayton as well. So we've pretty much got that Southwest Ohio, that footprint counted there between the Dayton and Cincinnati area. We've got most of those counties in our footprint now, which is great. And then the new big one for 2024, Columbus. So we'll be in the Columbus market in some select counties, the Franklin, Logan, Madison, and Union counties. For our network in Columbus, we just signed the Mount Carmel Health System yesterday. So they are officially in our network, which is great. We've also got COPC, Central Ohio Primary Care, which is an extremely large network of privately owned primary care centers, and they're going to be a big help for our network in Columbus as well. And then we are still talking with Nationwide Children's here in Columbus to add to our network. Ink isn't dry on that contract yet, but we're pretty close there. If we're able to capture them, that would probably give us a real solid network here in the Columbus market. So don't worry about writing this stuff down. We'll get this over to you guys just so you guys can have this for reference. But just looking at our growth here in the state over the last year, those 14 counties will be huge. That's going to, of course, give you guys, our partners, more IFP eligible lives to market towards. And we think that's going to add another possible 150,000 IFP lives just within those counties that we expanded to for 2024. So a lot of great new opportunity here, and really excited about the growth we've had this
Mitch,
far.
can you hear me? It's Jeff. Yeah. Just a quick question. One of the agents asked is about the Findlay area. Are you familiar with Blanchard Valley Hospital?
Yes. I'm not sure if it's in our network. I can check on that. I'm going to write that down. I can get back to you on that, Jeff.
Okay, great. That'd be fantastic. Yeah, we'll let you know.
Is Blanchard Valley?
Blanchard Valley, it's in downtown Findlay.
Okay. Got it. I will just wrote that down, and then let me check on that after, and I can, I'll email you after.
Great, thank you.
Yep. Okie dokie. So product. All right, I'm going to start off our product section by just kind of giving you guys a snapshot of what our typical consumer looks like. It's hard to measure this, but there's some stats that we can help generalize what our typical client looks like. As for the member age, the largest group of our members, as it pertains to a specific age group, has been that 45 to 64 age group since we re-entered the market several years ago. So that age group has continued to be our most heavily represented market. And this is a great opportunity for those that are in the Medicare space as well, which I know many of you are. Being that you start those relationships with those clients on an ACA product now, and then when they become of age of Medicare, you've already got them in your book of business, and then it's an easy transfer into our industry-leading Medicare products as well. So 45% of our members come from that age group. The next one is going to be that 22 to 44 age group. As it pertains to gender, our membership skews slightly towards the female, but not much. And then as you can see, English is our primarily speaking preference in terms of a language, but that Spanish section is growing rapidly. So if you've got Spanish speaking members out there, we've got a lot of materials that are beneficial to them. All of our stuff on the toolkit can be translated into Spanish, and it's available in that language as well. And, you know, as in addition to that, it's like 46% of all of our new IFP consumers are of a Hispanic background. So almost half of all of our members that we're getting now are of a Hispanic background. So important market out there, a lot of resources we're offering to help those clients as well. Year-to-date product enrollment. So in addition to our stats about our clients, I wanted to include this in here as well, just to kind of give you guys some numbers on which medal levels are most popular. Traditionally, silver has been the most popular medal level, not just in Ohio, but nationally, but that is changing rapidly, and it's shifting more towards the bronze level. So those $0 bronze plans are becoming more and more popular. So we are gearing our strategy to cater more towards the bronze market. We're still keeping, of course, silver and gold, but we are seeing that popularity amongst the bronze plans. So we are going to be making our products even more competitive in that realm as well. So and then as it comes to our product family, our Value Plus is still most popular. Value Plus being, I phrase it as kind of like a happy medium between rates and network. It's a good fit for most. It's just a good sweet spot. And so it's no surprise that that's our top selling product family. So words to the wise out there, you know, bronze, be prepared. It's going to be even more popular, we believe, in 2024. Interesting enough, and I've just looked at the stats in Ohio, we're split right now between bronze and silver, each at 46% of our total market share, and then gold representing the final 8%. I would guess that's going to shift more towards bronze for 2024. It's just the way the market is, and you know, we have to adapt accordingly. All right, so for our 2024 national offerings, if you guys have been on any of my presentations before, this slide will look very familiar, but there are some key changes, some key enhancements, I would add, for this slide for 2024. So that no-cost doctor visits, you've seen this before on our presentations. We're still keeping that. We understand that that's important. A lot of your clients want those no-cost doctor visits. So all of our plans, or most, if not all of our plans, have that $0 virtual urgent care and a combination of the $0 PCP visits. So just your $0 brick and mortar visits, we include those on all, if not most, of our plans. But in addition to that, for this year, $20 or less office-based labs are included on all of our plans as well, to go along with those no-cost doctor visits. Low-cost prescriptions, that's still extremely important. We know that that's on the top of the list in terms of what your clients are looking for in an ACA plan. So we are going to continue offering our low-cost prescriptions, or our $5 or less tier 2 generics, at all of our in-network pharmacies. And as you can see here in a couple slides, traditionally we have been, our in-network pharmacies, we've been partnering with Walgreens, but that is changing for 2024 in a great way. So more on that in a little bit. And then a lot of our plans will now include $0 insulin. You know, where that's a benefit that a lot of members are seeking. So we have included that in a lot of our plans for 2024 is $0 insulin, great perk there. Wellness on a budget. This was a pretty popular incentive for the past couple of years, and if you had sold plans with us in the past, you know that we used Peloton as the wellness sort of digital fitness app in the past, but we've also changed this as well for the better. We're going to be partnering with OnePass, which you can kind of think of as like a Renew Active or one of those types of companies, and I'll have more on that later, but this is going to give members on our Advantage plans a $0 physical gym memberships to over 17,000 gyms, as opposed to just a digital fitness option. They'll have the in-person gym options as well. And then all our other plans will still have $0 digital fitness on all of our other plans that they have access to the OnePass as well. So that's a great perk. More on that in a little bit. And then to round out our incentives here, rewards and incentives, we're continuing to offer that $100 member reward for completing a couple simple steps. But for this year, instead of just a $100 gift card to Walgreens, Amazon, or Walmart, it's going to be a debit card that we send out so they can spend it on whatever they want, which I think is great as well. And then members will still get that 20% over-the-counter discount on Walgreens branded items. So if they're in a Walgreens and they need some Walgreens bandages or what have you, they all get a 20% off discount on any Walgreens over-the-counter item, which is another awesome benefit. So a little bit more on this slide. It's still got the same stuff that we just covered in the last one, but a couple more items here. More copays. You know, we heard this from our partners. We heard this from our clients that they wanted plans with a more focus on copays. So we did just that, introducing a new product family, which you'll see here in a little bit, called Copay Focus, which is exactly as the name implies. It focuses more on those copays. And then the low-cost labs, once again, low-cost labs available on most of our plans for $20 or less low-cost insulin. So these are, when we talk about our national offerings, these are things that are included on every single one of our markets in all of our states, and they're uniform wherever you go. It's some great benefits. All right, so product families. This will look familiar to those of you who have sold with us in the past, but if you're new out there, our product families are an easy way to determine the plan in terms of its richness and who the plan's designed for and who's best used for each plan. So for example, the virtual first here, this is our complete virtual offering. It's been extremely popular. It was our #1 selling plan nationally in 2022. It was like top 3 this year as it stands right now. This is and in fact, it's our #1 selling plan in Ohio, the virtual first. It's that 24/7 $0 on-demand virtual care that's offered through our partnership with Galileo, and it's available at your fingertips. So you pull up the app, you communicate with your virtual PCP, you're getting the care that you need whenever you need it. And it really offers a tremendous value. That's why it's been so popular since our inception a few years ago. And now it was available just on bronze and silver, but now it's available on all metal levels, bronze, silver, and gold for 2024 because it's been so popular. Our value plans, I just spoke about our value plans not too long ago. These are going to be our flagship plan metal levels. These are going to be, like it says, a good fit for most. Like I said, a happy medium between price and network. It's going to be available across all of our metal levels. It's really just that sweet spot. It's a good fit for most people. The Advantage plan. So these are going to be our richer plans. These are going to include our adult dental and vision plans, access to the physical fitness benefit through one pass. And these are going to be plans for people that don't mind paying a little bit higher premium, but are going to have lower out-of-pocket costs when they go and actually seek care. So richer plans could fall in that Advantage plan family. And then the new product family for 2024, I just went over the Copay Focus plan. So this is that plan that's going to focus more on those copays. This is going to be a result of feedback that we got, like I said, that members and clients really wanted these copay style plans, that they're becoming more and more popular. So these are really designed to bring more cost predictability and more cost transparency for members because you have those set copays. Should be easy to sell, as these plans will be $0 deductible plans with those primary copay cost shares. So looking forward to this plan coming out. This is we're looking for this one to be a very popular plan, and excited to see what this one does for us and you guys as well. All right, so for our strategy here in Ohio, a lot to look at here. Like I said, I'm gonna be sending this out to you guys, so no need to write this stuff down. A lot in this chart, but there's some key points that I wanted to point out for you all here. So as it comes to our offerings here, we're maintaining our 16 plan portfolio, a nice even split between bronze, silver, and gold. 5 bronze plans, silver 6 silver plans, and 5 gold plans. So total of 16 plans. But a lot of variety within those plans. We've got plans that have adult dental and vision in them. We've got a couple HSA offerings as those have grown in popularity. So a nice mix, a ton of variability to offer to your clients, as we understand that there's a ton of diverse needs out there, that people want different things. So we want to make sure that we're giving them a ton of variety, but we're also not overwhelming them with plan types as well. So as it pertains to some of the benefits on our plans, I mentioned the one at the top that you can see highlighted there, the $0 brick and mortar is what that stands for, PCP versus $0 virtual PCP. As you can see here, those are available on a good amount of our plans, all but I think 3 of our plans will have that perk as well. So that's a good benefit that most clients are looking for when they're looking for a plan. $20 or less labs, I mentioned that's new for this year. All of our plans are getting that benefit. And then the 6 free diabetic labs screening, all of our plans are getting that as well. And so I mentioned you guys will have this chart. This chart's just going to list a lot of perks and benefits that we find our customers take use of, and then it's going to show you which plans and how many of those plans have them. So easy way to look and refer to that. All right, virtual care. I mentioned virtual care, extremely important. And our virtual care is going to come in 2 forms. So the first one there, our virtual first plan, as I mentioned, this is one of our plans that we offer that's a complete virtual option. It really provides a tremendous amount of value. It's at 24/7. All care access through the app is $0. It's unlimited, and you can access it anytime you want. It has a great Spanish speaking experience for those clients out there that prefer Spanish. And you get referrals from your PCP and Galileo, and then you have access to our in-network, in-person providers for specialist service. So if you need to get some lab work done, you need to get imaging work done, you need to visit a specialist, you just pull up the Galileo app, you get your referral from your virtual PCP, and then you have access to our in-network providers for those services. So great value with our virtual first plan. I'm sure that is going to continue to be popular this year. So that is just for the virtual first plan. But for all of our other traditional plans, our in-person plans, you also have a virtual care option as well. And that's going to be offered through our partner, Optum, our internal partner, Optum. So Optum Virtual Care is going to be available on the regular in-person style of plans. This is going to come with virtual urgent care services, $0 once again for that care. There's a 24/7 care support phone triage available in case if your clients need some care that they don't need to go seek in-person care for. They have that 24/7 phone support care and virtual care access that they'll have available on tap for them to use. And this will be now integrated with the My UHC app. So the app that the members are already using, they can access this virtual Optum care right through the app at any time. So it's great. So whether it's a member that has our virtual first app or they've got a regular app, they have that virtual care option on all of our plans, which is great. All right, and then real quick, I wanted to throw these in here, our dental and vision benefits. So like I said, these are going to be available on our Advantage Plus style plans at Richer Family. And you can see here the maximums here and the benefits. A quick note though, as far as it goes with pediatric dental, we've really been one of the only carriers to offer embedded pediatric dental on all of our plans since we re-entered back in 2021. So this provides you a great differentiator. A lot of our partners didn't even know that we had pediatric dental and vision on all of our plans, but yes, we do, and we're one of the only carriers that offers it. It's embedded in all of our plans. Like I said, a great differentiator for your clients. Vision as well, another great benefit to have, but pediatric vision once again embedded in all of our plans. Not many carriers doing that out there, great differentiator. But now contact lenses are also covered at up to $130 to go with the lenses. We reduce some of our co-pays for those exams as well, down to $25. So upping the benefit on the pediatric or the vision side as well. So great value. Our Advanced Plus plans have been extremely popular because of these adult dental and vision, but like I mentioned, pediatric dental and vision offered on all of our plans, which is a great differentiator. All right, the fitness benefit. I mentioned this is new for 2024, so we're moving away from our partnership that we had with Peloton All Access, and we are switching to OnePass. And like I said, you can think of it as kind of like a Renew Active. It's like a general admission ticket that you get to access all of these gyms. So once you sign up, you get access to over 17,000 physical gyms. You can see some of the names there as well, available on our Advantage Plus plans. But if you've just got another style of plan, you still have access to the digital fitness solution. So they've got a massive library, over 40,000 digital fitness solutions that all of our members would have access to. So we're really excited about this perk. This is going to be a nice benefit to have and offer your clients. So to go along with that fitness benefit, we're maintaining our other incentive package here with that $100 member incentive. And I mentioned that for this year, it's going to be a debit card style and not just a gift card. So the member will be able to spend it on whatever they want. That 20% off discount on all Walgreens over-the-counter items. And then lastly, to round it out, we're maintaining our partnership with AARP to offer that $0, that free AARP membership to all of our members over the age of 18. So this membership comes with a lot of great benefits, discounts, all kinds of great things that come along with that AARP membership that our members will love and they take advantage of. All right, so marketing efforts. I want to touch on this too. We are really stepping up our game when it comes to our marketing efforts. And I'll show you here in a few slides, but we know that marketing really drives the success in the market. And we want to make sure we're providing you with all kinds of tools and resources that are going to help step up your marketing efforts and get exposure to the clients out there. So we're going to be driving continued awareness and consideration and preference to the UHC brand by our marketing efforts, our clear and distinct value proposition, in addition to our communication strategy. And we really wanted this to help drive not only member retention, but renewals as well. So we're going to be seeding the ACA market with information throughout OEP and throughout next year, really providing a bespoke approach to a bunch of different target audiences. So in addition to that, like I said, providing your teams with added value, with value-added tools to support your marketing efforts across the sales and marketing funnel. So in addition to that, newly enhanced member onboarding experience, we've made leaps and bounds in that regard as well. Improvements to our payment process and then member engagement initiatives. So how are we going to be doing that? You know, as we look at driving IP awareness, we're going to be hitting it from all sides. So whether it's social media, whether it's mainstream television, and everywhere in between, you can see here just the different marketing avenues we'll be hitting this OEP in 2024. So we're really going all out on this. We've got marketing materials available in Spanish and other languages, and we're really stepping up our game. We really want to drive that awareness to the clients and then drive that client back to you guys, our partners, from these efforts. So we're going to be having a somewhat of a digital first media approach, like I said, focusing on all the different channels, social, YouTube, all the different kind of channels. But we know the consumers have different mindsets. So we're continuing to adapt and innovate in terms of marketing strategies and our approaches, really just trying to hit it from all sides and take advantage of all the different types of clients out there. So a lot more on this to come, but pretty exciting here when you talk about just the marketing efforts that we'll have. So that's for somewhat of our external marketing, you could say, but internally, what are we providing for you guys to take advantage of? And there's a lot of new stuff that's on the toolkit for just about every scenario when it comes to marketing. So the toolkit, what is it? It's essentially like our internal portal that all of our agents have access to with all kinds of tools and resources for them to take advantage of. So agents that do use the toolkit sell approximately 10% more applications than agents that don't. So if you haven't used the toolkit before, heavily recommend you guys get on there and just explore it and see all the different resources that are available to you guys. So things that are on there, customizable flyers, brochures of all kinds. You can put your contact information, phone number, name, and all that stuff on these brochures and customize it however you like. Digital and social media ads. There's all kinds of new Facebook and digital and social media ads available for you guys to use. Different office collateral, print materials, shopping sheets, all kinds of stuff. Like it's really just grown in the past couple of years to include all kinds of stuff. It's all customizable, and honestly, the best part about most of that stuff on there is it's completely free. So why not take advantage of it? So with the toolkit, book of business marketing as well. So we want to make sure that we have materials on there that is going to be pertain specifically to your book of business to help you market better towards your book of business, to help grow that book of business and help retain that book of business. So when we talk about retention, this is somewhat of a new campaign we're going to have this year for you guys to take advantage of in terms of what's available on Jarvis. So we're calling it the 365-day journey. And so what this means is there's going to be marketing material for you guys to access all year round, and it's going to be designed to be sent out specifically timed. So when you first sign a client up, we've got stuff for that new client, the welcome material, what's next flyer. There's checklists on there to make sure that they're all set up. And there's also stuff available for 30 and 60, 90-day engagements so that we give you guys resources and marketing materials to send out to your clients throughout the year to keep them engaged. So whether it's the 30 or 60, 90-day stuff, there's stuff that's you can send out that's going to make sure that they're taking advantage of all their plans, that they're making sure that maybe they've signed up for OnePass or they've collected their incentive gift card, all kinds of stuff there to keep them engaged and keep them retained. So this stuff is, like I said, all available on Jarvis. It's all free of charge. So why not take a use of it? Some great material to keep that client engaged. We know that if a client's engaged year round, they're more likely to stay with you for the long term, and you could keep them in your book of business as long as possible. All right, so pharmacy and clinical, this is exciting. I mentioned previously we had been working with Walgreens as our preferred pharmacy, but for 2024, I alluded that we are greatly increasing that. So you can see for 2024, we are increasing by the number of pharmacies that we have in our preferred network by 5 times. So now it's no longer just our Walgreens as our preferred pharmacy, but you can see some big names there. Kroger, Walmart, Rite Aid, some of the new providers that we'll have in our preferred pharmacy network. So this is giving us a much bigger network in terms of pharmacies. Really excited about this. You know, this should be a great enhancement for your clients out there in terms of just the sheer number of pharmacies that they will now have access to. All right, and then wrapping up here towards the end, ending on operational enhancements. So a few notes here. Our IFP Connect newsletter, this comes out every other Friday. It's been extremely popular. And what this newsletter is it is a quick read that's going to provide you guys with resources, tools, and other innovative solutions that will enhance your experience with the UHC. It really aims just to keep you guys connected and informed with all of our operations and provide educational tips and showcase new tools and technologies that we're continuously rolling out for you guys to take advantage of. Like I mentioned, if you're not subscribed, go ahead and subscribe to it. It's a quick couple-minute read. It comes out every couple of weeks. It has like a 50% open rate, so it's extremely popular. It's just to keep you up to date with all things ACA and UHC. Oops. And now it's available in Spanish as well. All right, so for Jarvis, so we kind of talked about the agent toolkit and some of the marketing materials, but on the operational side, there's some great new enhancements here as well. So new reporting features, these are going to be coming live soon. So if you're in Jarvis and you're looking at your book of business, you can now generate reports that will show you who in your book of business has a late payment, who's turning 26, and who's turning 65. So these are going to be available right on your homepage when you go to your book of business. You'll be able to generate reports in real time. You can export those to Excel so you can see who's late on payments or who's turning 26 or 65. So this is just going to give you some more access into your book of business without having to do that manually. I'm really excited about this reporting feature. I think this is going to be extremely useful for our agents out there. And this is just a snapshot of what the late payment report will look like. So you can see here, you get a nice report generated of all the clients, and hopefully you don't have any that have those late payments, and you can easily, like I said, export that to Excel and perform the appropriate outreach to those clients to let them know. And you can even send emails right through this report as well. You can send direct emails. As you can see here on the far right, the tab, the far right column, there's an email button. You can send an email right through there and let that client know that they're late on their payment and help them get that back in there, which is great enhancement. Member ID card can also be downloaded from Jarvis as well. So this has been around for a year now, but if your client loses their card or is waiting on a new one to be sent to them, they can download their member ID card straight from Jarvis as well, which is a great enhancement that was brought about by the feedback from you guys, our partners. And then lastly here, off exchange. We're continuing to offer our off exchange plans as well. 2 ways to enroll your members in an off-exchange plan. One is through our internal MyUHC website. And then the next one is going to be through Health Sherpa, which Jeff just talked about here in the beginning of the presentation. So Health Sherpa, real easy and intuitive platform to use, and you can quote our off-exchange plans there as well. So with that, we'll leave some time for Q&A if we got any time.
Sure.
There's a quick survey on there if you don't mind. If you got a couple extra minutes, just helps our marketing team with these types of rollouts and see if there's anything that we missed or if we can do better. But other than that, thank you, Jeff, and thank you everybody for joining us. And
fantastic.
Not sure questions or not,
Yeah.
but feel free to fire away.
Yeah, you can hear me?
Yep.
Okay. Eric, could you unmute Brad? I want to bring him in. Brad, can you unmute yourself? Hey, Brad.
Yeah, I'm here.
Yeah, let's roll through some of these questions, and then we'll get some follow-up feedback from the panelists and whatnot. So, one of the comments was, in Southwest Ohio, you guys are working on your network, and we've got 4 hospital systems down here. So one of the comments was, we're looking for that to expand for you. Can you talk about the progress you've made in the last couple of years with your Southwest Ohio market?
Yeah, in terms of a network.
Yeah, who'd you add in this past year? I think you added some.
So we started out, it was mostly Mercy down there, but we did add Christ Hospital, which was a big add for us. So, with our network, it's something that we're chiseling out over time. We want to make sure we're doing it the right way. So it will continue to grow, but as it pertains to Southwest Ohio, it's Mercy mostly, and we've now got Christ, which is a big add there, and it'll continue to grow as well.
Okay, and we'll see what 24 brings as well. So, and Brad, do you want to take the next question?
I can't see the questions as I'm signed in, sorry.
Okay, that's fine. We'll just rattle through these, and then the next question is, when enrolling a client on the exchange, are you able to set up auto pay for them at that time?
Yes, absolutely. So whether it's through Health Sherpa or it's through our internal system, you can set up auto pay right when you do it. I would definitely recommend doing that as well. So right when you sign a client up, get that auto pay, and that'll serve as, of course, their binder payment. Their coverage will be active immediately, but then you won't have to worry about collecting payment from them every month. So great question. Absolutely, you can do that, and heavily recommend doing that as well.
Great. And then next question from Denise. Not sure if I missed it, but what network is used for the adult dental and vision?
So it's just our internal UHC PPO network.
Okay, great. Fantastic. And then one last question we have, and then we'll get some more feedback. Are the premiums the same for on and off exchange?
Yes, yep. So they will be the same. The rates will be the same, but of course, when you're on the exchange, you get to take advantage of those subsidies.
Okay. And I just want to ask Brad, what are your thoughts and comments on this UHC ACA product?
So I think, guys, I was in person with Mitch a couple of weeks ago, and getting to see this a little closer and all the details, I really, really love all the extra benefits, like fitness that people probably would use actually more than their medical, right? Some people use it a couple times a week, some people daily, not me. But I liked a lot of the extras, and I thought that was really great. AARP membership to those that applies to, but I think also, oh guys, hang on a sec. Sorry, I had a call coming in on the computer. The 20% discount at Walgreens on their private label products is a great benefit as well. So those are some of the things that I like. And I also thought that getting notification in your book of business for those that might be aging out as a 26-year-old and those about to turn 65. as a great reminder, because I know we all get busy. Mitch, one question I had, and if you mentioned it, I'm sorry, I've been getting texts on other topics. What are we looking at? Have you heard, since I saw you 2 weeks ago, what our rate change is looking like for 2024 in Ohio, or is that still TBD?
Yeah, it's still TBD. I probably won't know until right before OEP. They kind of keep it tight-lipped, but I would still predict that we're going to be competitive in most markets. I don't see us taking any sort of dramatic rate change or anything like that.
Okay, so some things I've been seeing that, you know, CMS has published, looking like Ohio, sort of all average, all carriers, is about 7%. And I know that, you know, that's the average. And as we hear, sometimes it varies by county within the state, some higher, some lower. So, and just for everybody, as you all know, whether you sell group or individual, and just in general, your own health plan, cost of healthcare is going up like everything else, unfortunately. So just be prepared.
Okay, great. Great comment. So just one last question, then we'll let everybody go. To the point on the off exchange plans, are brokers allowed to terminate those on behalf of clients, or does the member need to do that themselves?
You know what? That's a good question.
I always hedge on the safe side. I think the client needs to call in. That's more or less the procedure with the other carriers. But, but we'll get more information for you.
And I just have one comment to make too about Columbus. I think the expansion in Columbus is a great hit for that market. And the network looks pretty strong, having COPC and NOMS, as well as Mount Carmel. So yes, it's not everybody, but nobody has everybody. So I think that's a nice thing. And if they can get Nationwide Children's, that would be a great addition to the plan in general, to have Children's Hospital. Mitch, I can't remember. Is there a Children's Hospital available in Northeast Ohio?
Oh, absolutely. Well, I think that's Rainbow, but I'm not sure. Is that in network?
I don't. The name doesn't sound familiar. I don't think we have that in Northeast.
So it's a University Hospitals is Rainbow, maybe.
Oh, okay.
No UH at this moment. Something that we're working on getting with. But in Columbus, like I said, Nationwide Children's were pretty close to the finish line there. That would be great to have them in. And I'll, of course, keep everyone updated on changes there.
Good stuff, everybody. I know we're at the end of the hour right now, but I do want to thank Mitch for joining us today. Any final comments, Mitch?
You know, I just want to say thank you, everybody, for being on, and thank you, Jeff. But as it comes to 2024, I think this is going to be a great year for us. I think we're really just taking a turning point in what we're providing, not only in terms of our competitiveness, but our portfolio all around is going to have a lot of great differentiators. And want to thank you guys all again for hopping on, and reach out with any questions or if there's anything else I can do to help you guys get prepared for OEP. But thank you.
You bet. And with that, we'll conclude the presentation. Everybody have a great day.
Thanks, everybody. Have a great day. See you soon.
Thank you.